Ma'am, you are live now. You can start.
Okay. Hello everyone. This is the last session, live session. So looking forward to see you all. Uh, Let me know if you have any question, any concern, any suggestion for our NPTEL course going forward. So go ahead and please go ahead and let me know. I'm looking forward to your results actually. I'm sure you all will do very well. Questions are not very difficult, so you all will do well. And I also want to know how are your last 4 5 week sessions. Whether you learned. We have focused on mother's nutrition, lactation, complementary feeding, and just basically LAP protocol, learning action protocol, nutrition charts. So, let me know what do you think. Um, Bella, are you there? If you're there, just please go ahead and let me know about the questions. Uh, I'm not seeing anything so far on YouTube. So if you find any questions, let me know. Okay. Am I live? Because I can still see people waiting. They have not joined the session. So I don't know if there is any issue.
Ma'am, you are live. We can see here.
Okay, okay. Because I'm not seeing any chat. So I was wondering what's happening.
Actually, there are 10 to 12 chats.
Oh, I can't see anything. How do I how do I see those chats?
Ma'am, try to just once refresh the YouTube link.
Okay. Uh, okay, fine. So I can see, Natasha, you're there. There are questions in the chat. Uh, Ma'am, your mic is off. Can you hear my mic? I think you guys are hearing. Yes. Hemma, thank you so much. I was just wondering whether you received email. You had this issue, so I got that email from you. I just want to make sure that you received, that email communication is on. Uh, Okay, Sonika, your question is child who is born preterm, having secondary lactose intolerance, and has lost weight in spite of successful breastfeeding initiation. Also, how much and how can we introduce lactose drops for such child, lactase drops for this child? So the thing is, it's very uncommon in babies to have lactose intolerance, specifically on mother's milk. So babies on mother's milk, it's really like very, very rarely that we see lactose intolerance. So I wouldn't worry. I'm not sure. Oh, there's a successful breastfeeding, which is great. So I won't worry. Continue giving breast milk and find a different cause. And what are the signs and symptoms of baby? Like, why are you thinking that baby has lactose intolerance? So I need to know that. What are the signs and symptoms? But I would not do anything till baby turns 6 months. After 6 months completion, you can start complementary feeding, as per recommendation. But very rare to see lactose intolerance. Okay, sometimes what we do find is mother can stop dairy, and that may help. Some babies might be allergic to cow milk protein, and I do see that in my US practice. Okay, so you can ask mother to just maybe try 2 or 3 weeks of stopping dairy or even sometimes eggs, and see if that helps or not. But otherwise, pure lactose intolerance in babies is kind of very rare. Okay. Uh, Celiac disease is more common than detected in Indian babies due to logistic issue in diagnosis. How to advise complementary feeding kidneys? Oh yeah, absolutely true, Jyoti. You're absolutely right. Child may not have celiac disease, but it could be just a gluten sensitivity, or gluten intolerance. So what I recommend now is to not to start wheat. In fact, I don't recommend wheat even in normal babies. So go ahead and recommend more of millets. Ragi is really good, very high in calcium. Jawar bajra is also good. But kind of have more pulses. Animal source food is really good, vegetables. But avoid wheat. Avoid wheat in a normal child. Okay, I don't recommend wheat at all nowadays. Uh, Dr. Sarita, I'm enjoying doing the course. It is very useful in my practice too. Thank you so much. Dr. Sarita, what I recommend is to you make a research out of this lecture or this nutrition course. Find a topic and do research and see what you were doing before versus what you're doing now. What is the difference in terms of weight gain? What is the difference in terms of length gain, and also in birth weight. So if you're dealing with pregnant mothers, it would be good to have some evidence and publish. Okay, so I think I really recommend that. Uh, Salva Purani, thank you. Good afternoon. Sonika, ma'am, my child had and she was recommended soya milk, but later I was told by another pediatrician about lactase enzyme drops. Thing is, I don't recommend. The thing is, I don't know how old was your baby, but very rare to have lactose intolerance in children. And why? I don't know why. So this baby was not on your breast milk. That was my first question. If she was on other formula, did she have any diarrhea for a long time? Did she have, say, 3 weeks, 4 weeks of diarrhea? Because in those cases, sometimes we see. So there are a lot of questions I had. So it's just offhand saying the child has lactose intolerance. I can't take it. Okay. Dr. Mariam, hello Rupal ma'am. This is Mariam from Hyderabad. Could you please connect me to person as you mentioned last time? So this is Vinoda. Mariam, I need to connect you with Vinoda. So can you please send me again email if I missed it, and I'll connect you with one of the very good lactation consultant over there. In exam, there are multiple choice questions. Okay, so don't worry too much. There won't be any question from recipes. So you don't have to go through recipes again. It will be all basically theoretical and applied question, but nothing from recipes. Is there any chances of resubmit assignment I missed too? Unfortunately not, Himmat, because there was a time period, so you were supposed to, it was time bound. Okay? There is an image online which depicts the size of stomach newborn on day 1, 3, 7, 30 as cherry, walnut, apricot egg. Is it okay to use that image during counseling? Yeah, you can, but better is to use the spoon, correct? Because mother will be able to relate to spoon. Like if you say if it's 5 ml, then you just show 5 ml spoon. If it's 15 ml, you show 15 ml spoon. If it's going to be 10 ml, you show 2 teaspoon. So it would be much easier to show teaspoon because mother will be able to relate to it. Okay. What about feeding techniques in case of surrogacy and adoption of child immediate after birth? So the thing is, that's the whole different topic about starting lactation in surrogacy and adoption. So that I have not covered in this in my entry course because this course is currently we don't. It was very super specialized topic, on feeding techniques and surrogacy. So that there is one doctor who is doing a lot of relactation, and if you want, I can refer you to her, and basically she can take a session on that. Sonichi, best 8 assignments are taken. Yeah, that's true. Is it Vinoda Vundam? I don't know the last name. I don't. I know just the first name, Dr. Mariam. But it's, yeah, it's basically she's a physiotherapist, and she's Vinoda, excellent lactation counselor. Uh, if a family is it's egg, chicken, and meat on regular basis, it's necessary for them to include pulses, legume, and millet. So no. If if you are eating eggs, chicken, meat, it has pretty much all the nutrient. Magnesium is lacking, okay, in a lot of this non-veg products. So I would, and also some amount of potassium. So for that reason, I would definitely kind of give chicken, legumes, and also some leafy vegetables, and millets too, right? Millets. So because if you're giving pulses, then you'll have to give some millets to combine it. Okay, so that's important. That, yes, I would definitely give. I would not just put babies on meats. Other, like, all 8 food groups are important. Uh, Bharti, for week 12, we need link for nutrition chart, etc. As no transcript available for week 12, asked by Hima Singh. Okay, so Bharti, we can ask, I think we already had linked last year also to upload this nutrition charts in different languages. So please, just do ask Hema. Natasha also is here, so you can ask Natasha Villa. Is it okay to consume Himalayan pink salt instead of iodized salt? Who would like to know the effect of consuming iron salt versus Himalayan? So the thing is, now, Dr. That's a very good question. Pink salt doesn't have that much iodine as iodized salt. So if you have a problem of hypothyroidism, or if you have any other, iodine, like lack of iodine related issues, so I would definitely take iodized salt. What you can do is, in salt, in lemon water, you can use some pink salt because that will give you some flavor. But otherwise, in food, you can use iodized salt. Make sure that when you put salt, it should not be in a very hot temperature. Otherwise it will get sublime. It sublimes. So make sure that you put it. Once you finish cooking, you let it cool a little bit and then put salt. Okay, great, Dr. Mariam. I'm so glad. Do connect with her, with Vinoda, and find out, how you can join her. Okay? All right. So, any other question? Hema, if you have any other question, let me know. Anything that you would like me to add in the next year session, do let me know, because I'll have to prepare to add more topics. Okay, and I'm also thinking of floating adult nutrition starting from January. Okay, and adult nutrition would be more on prevention of diseases and revision of metabolic disorders. So I'll go kind of a little deep into cell biology, nutrition biochemistry, different carbohydrate, fat, protein, um, nutrients, and also some micronutrients. So let me know if you're interested, but I would definitely like to take that session. I'll be floating that topic. How can we get the performer you used in last session? So you're looking for LAP card, right? Data card that we use. That also we can upload. So definitely, Bella, you can upload that also. Upload those data cards. So if they want to use it in their practice, they can use it. I've gone through one case last week. Baby had frequent diarrhea since 1 month. Pediatrician suggested it's because of lactose intolerance. Baby's on formula milk. What can we suggest to her? Yeah, I don't know why children are getting lactose intolerance. I really don't understand. They had diarrhea for 1 month. Okay, so there was antecedent diarrhea. Maybe, and how old is the baby? If you can give me the age, I can tell you what to do. But I need to know that. Hi, Dr. Archana. How are you? Can we get practical experience or topic discussed in the course after the exam? I stay in Bangalore. Yes, yes. So what you can do in Bangalore, in fact, you can connect with Dr. Asha Benekappa. She is running the internship program where you can basically do internship, in her hospital, and it's basically I think 2 weeks or 4 weeks. Okay, so you can do internship, and you will learn a lot practical aspect. Please give the link for lectures in 12 weeks. Yeah, so I think that 12th week lecture is already gone. I don't know, just let me know that the 12th week lecture is already gone. But if not, then or you mean Dr. Archana, I see nutrition chart LAP. Okay, okay, we will give that link. This is 3 month old baby, so you can try soya milk. Okay, Vinny, you can try soya milk and see if that helps. Uh, Galaxy of drawing, do we have negative marking in exams? There is no negative marking, not in NPTEL, no. Uh, so lectures 57, 58, 59, 60, 61, 62. Okay, okay. So you need the lectures link or you need IC link? So just let me know and I'll figure out. Is there any similar practical internship in Chennai? Not as yet, but there is one more consultant over there. I will find out if we can have a kind of a facility to do, um, or I can ask Dr. Benekap also if she has any consultant who is working in Chennai. But yes, I'll find out. You can include a crying baby, it's not always hungry baby. And when is it time to supplement? Yeah, yeah. Okay, fine. Yes. Generally, I don't recommend supplement at all, to be frank, because we have we have put this physical mess to improve breast milk supply, and most of the time that works very well. So just frequent feeding, complete emptying of breast. Mother can manually express breast milk and give her milk rather than giving supplement. So all that I recommend. I don't recommend starting babies on formulas at all. Uh, okay, got it. I would like to do internship for gaining practical exposure. I stay in Mumbai. Okay. All right, Rupal. So I will try to find out. My work, of course, I'm professor at IT Bombay, but my work is predominantly in tribal areas, and rural areas. I don't go to any facilities in Mumbai per se. But what we can do is we can plan one visit to one of the hospital, like a rural, urban care hospital, urban primary care. I can show you practically. Rupal, keep in touch with me through emails, okay? Internship in Nashik. Yes, there is an internship. Actually, we haven't started. See, the thing is, this course is just 2 or 3 years old. So we are still looking for collaboration to start internship programs all over India. We have done it in Bangalore, but we are still looking for. If I have more people who have done an NPTEL course, then they can start the internship program. I'm talking about pediatricians, you know. But Nashik, one more thing, what I can do, we have done a 1 year project with Nashik administration, as you must have seen from my videos. I can see if you can attend, in one of the urban care or maybe primary healthcare center where doctors are trained, and we can, you can learn from them practical aspect. They're giving amazing results. These are government doctors. So do keep in touch with me through my email. How many questions will be asked? I think there will be 100 mark questions. So 100 questions. Internship in Lucknow, yes, there is internship in Lucknow. I have one Dr. Tanima Singh. She is doing amazing work in lactation. She is the one, in fact, who is specialized in relactation. So if you can connect with me on email, I will definitely connect you with Tanima. Okay. Natasha, if you can just write my email, that would be great. So, just put my email address in chat and they can connect with me. So that's my email. Okay, so looks like there are no questions. So I'm going to say goodbye. All the best for your exams. Exams are very easy. Just think and answer. 100 marks. So there'll be 100 questions. Okay, and you'll do well. It's very simple. And these questions are very kind of practical. This will help you in your practice also. Do keep in touch with me because once you show good results in your baby weight gain, and if you share your results with me, I would like to take you up as trainers. Because we train in a lot of different districts, so we're always looking for trainers. So let me know, and I will. I'll create a list. So thank you so much. All the best, and it was wonderful having you on this course. And keep in touch. Okay. Thank you so much. So Bharti, I'm going to leave now. Okay. There aren't many questions. How to score more marks? Just study hard. It's just as simple as that. Okay. And I'm hoping that you've taken notes. So just make sure that you take notes. I've just kept it Dalal Rupal, Dr. Mariam. My email is, I've put it up. Just scroll the, chat. Uh, how can I use this video if I want to share in my YouTube channel? Yeah, you can basically, you can go to Health Spoken Tutorial. So Health Spoken Tutorial YouTube channel, like IIT Bombay. So this is our channel on YouTube. So you can share any of those videos. Okay. It doesn't have my live video. Live video you can share directly from NPTEL website. Okay. Okay. And here I'm still, again, I've already posted my email address. It came from Dalal Rupal account, but you are upset again. Okay. So yeah, so YouTube videos we have all the tutorials that you saw. Those are all we have it on YouTube, so you can share those. I'm from Lucknow. I'm working under Dr. Tanima. I'm dentist in public health professional. So further, what I need to do work in this field so that I can reach more mothers. Yeah. So yes, of course, and I'm sure Vinny that you liked our NPTEL course. I'm sure you've learned a lot. Do practice on mothers, okay, and document your results. And do document your results because you can publish and it will help you to get more clients. Do give my regards to Dr. Tanima, and I'll talk to her to start the internship program in Lucknow as well. Okay, so your chats are not coming on YouTube chat, doctor. Oh, I don't know then what to do. Okay, you can write down. So it's my last name, Dalal, DALAL underscore Rupal, RUPAL at yahoo.com. Okay, so you can put my Dalal underscore Rupal at yahoo.com. So if somebody can type it, I can see if it's correct or not. Okay. So, okay, all right. So I'm going to take your leave now. Okay, all right. Bye. See you.